பரணியெங்கும் தமிழரின் பிம்பம் உங்கள் TVI.
Welcome to CrossRoads on TVI, a show that showcases the Tamil Canadian community, their issues and their successes. I'm your host, Manjula Salvaraja. Today on our show, we'll be talking about the state of mental health in our community with a panel of experts, and then welcome Dr. Sathyamoorthi to our studio, a well-respected humanitarian and medical superintendent at the Vanni General Hospital in northern Sri Lanka. Let's start our panel discussion. I have some questions for you, our audience. What are your thoughts about the state of mental health in our community? Is there a stigma around talking openly about it? If so, why? Are people in our community getting the help they need? We would love to hear from you, our audience. Call 416-623-8100 with your answer or a question for our panel. And let me take a minute to introduce our panel as well. YouthLink, a Scarborough-based United Way member agency, will soon be releasing a report about the state of mental health in the Tamil Canadian community based on assessments they have done in the area. Juanita Nathan is one of the authors of that report, a YouthLink counsellor and a York Region Public School Board trustee. Her extensive volunteer work in the social services and mental health sectors was recently recognized when she was awarded the Queen's Diamond Jubilee Medal. Kamalesan Muthulingam is a counselor at YouthLink. Formerly an engineer, Kamalesan was motivated to get involved in the mental health sector after seeing the struggles of a loved one. He has a master's in counseling psychology. Dr. Pushpa Kanagaratnam is a Toronto-based registered psychologist, and from what I hear, the only Tamil Canadian psychologist in our community, which means a ton of people out there have to go and get into that field. It's a very important field. Her research has been focused on the effects of war trauma in immigrants and refugees. She has many years of clinical experience working as a family violence counselor and as an international research fellow at the University of Toronto and Centre for Addiction and Mental Health. Welcome to the show.
Thank you.
Such extensive bios. That's this is definitely a panel that is here, the right panel on this topic. So Juanita, let's talk about this report again. I mean, sure. You surveyed, I believe, youth, parents, and seniors.
Yes, so we just had under 18 and then adults, so two separate surveys. And it was distributed to residents of Scarborough. So this survey is only for Scarborough Tamil-speaking residents.
Now, were there any particular, what are your findings with regards to, I'm actually curious about the different findings that you had for these different segments.
Oh, right. So in terms of, like, we asked questions, basically, as you know, YouthLink is a children's mental health agency. Mm-hmm. So as such, we are kind of concerned about, are we meeting the needs of a particular community that's living where our agency is located. And this particular needs assessment came about because there are the East Quadrant Children's Service Network, along with Psychology Foundation, wanted to find out if agencies who are in the East Quadrant are meeting the needs of the immigrant population who's very much prevalent in Scarborough.
Okay.
So through that, we found out that the Afghan community, Tamil community, and the Mandarin-speaking community are the most living in this area and also had the most needs as far as mental health is concerned.
Okay.
So my questions when I was distributing kind of wanted to pry a little bit about if the needs of their mental health are being met.
Okay.
So the youth, just to find out like what types of issues they are facing. So we asked them a lot about do they have friends in school, what's their self-esteem is like, and do they get angry a lot, or how their relationship with their parents. And also asked a question about mental health. What does mental health mean to you? And we asked kind of similar questions to parents in terms of about settlement issues, so housing, transportation, jobs, and also a common question that we ask both are about if they've experienced the war directly themselves. So the parents' answers are very typical of what you would expect that the town people would give, because they are basically first generation here.
Yeah.
Now the youth answers are very interesting. When you a lot of them, even though they are born here, like so 2/3 of the youth that I've interviewed and surveyed are born here.
Okay.
And they have not experienced the war themselves directly, but each of those kids had so much to say about how war is stupid, or they lost so many people, and they want peace, and a lot
That's
of things.
interesting. So it's actually an indirect effect.
Of course.
Of conflict-related trauma. That's very interesting. And Cam, perhaps I'll get you to expand on that, because you work as a counselor in the community. What are some of sort of the mental health concerns or issues that you encounter?
Like in my work as counselor, like I've always seen that Tamil community needs, the mental health needs are more complex. Like Juanita explained, we have only 1/3 of the population who actually experience direct war trauma or even trauma related to the tsunami in 2004. But what we see here is a term called intergenerational trauma. Although the family, only the 1/3 of the population witnessed the trauma, it's kind of passed on to the next generation, unfortunately, because it's in the family, it's passed genetically, and then the third term would be vicarious trauma. People hear those stories, and there are still loved ones back home in Sri Lanka, and that affects them. So with Tamil community, like I don't work with just one issue. It's more than one issue. The term again is comorbidity. So it's either like drug use or alcohol dependence plus like depression, or so it's always complex.
Okay, so it's never something that's clear cut. And I'd love to get you, Dr. Pushpa, to kind of add something. I'm going to take it a little bit broader. Do you think that the Tamil Canadian community is more susceptible to mental illness?
You know, in fact, like listening to Vanita and Cam, and also it's just my opinion. Also, I wanted to say, like overall, even having done some research in the Tamil community on war trauma, actually, I would say that we should be proud about our resilience as a community. Definitely, issues that you have told exist, and I see a lot of Tamil people, you know, struggling. But I wouldn't say, you know, based on what we have gone through, all the issues like torture or rape or material loss or lives lost, whatever. So people have this determination to move on. And as a community, I think we are very resilient. But at the same time, I think what you guys were talking about is maybe there are issues, not maybe, there are issues, right? A lot of issues that people just repress, like, you know, because we know so many women have been raped and so many people have been tortured. Where do you hear these stories? We don't hear, like, so people suffer silently, and it kind of manifests maybe in different ways as domestic violence or alcohol addictions, you know, and mental health issues. So I don't think we should kind of get alarmed and say, oh my God, what's happening to the Tamil community? But because we need more research-based evidence also to see, okay, compared to other communities, how are we doing? Or compared to other war-torn communities coming from war-torn countries, how are we doing? So, but maybe it's not that significant, but we need to look into our community also, but then also thinking about the positive side and the issues that we have to deal with, right?
Now, I know that I'm going to read actually a question that came in from our Facebook page from an avid watcher and also a past host of this show, Ann Aryadasa. You've identified conflict-related trauma as one. She's curious to know about factors, so other factors that make the Tamil community more vulnerable to mental illness. Do you think there are any other factors of that nature, like immigration or?
Definitely, because our community is a new community to the country. As such, any stress that's related to settlement is always there. Now, that is coupled with all the trauma that they're already experiencing is what is causing all the depression and the stress. Now, another factor is that our community does not go out and seek help for this. Because like Pushpa Dr. Pushpa said, we are very resilient. We just only focus on going forward, and we're not dealing with these baggages that we are carrying with ourselves. And it comes out subtle sometimes when a little issue happens at home. It comes big because they're not really dealing with what's there underneath.
That's actually an interesting point, because I think you've said that that's come up in your study too, right? And actually a couple of people that wrote in said the same thing. So the question for you, Cam, because you are, both of you work on the ground as well with people in that community, and you're also bilingual, you're a Tamil speaking counselor. You know, are people accessing or getting the help that they need?
Unfortunately, very few population are accessing or even able to access services. And the more I find is some of our Tamil families, they don't complete the treatment as well. So that is also an issue. Like she was saying, the stigma about mental health also plays a big role. But more than that, there's like some myths around mental illness. Talking about it would cause me a breakdown. Those kind of myths, some of our like Tamil families still exist.
Okay.
So that even makes it harder for our people to access services.
So it's actually, you're saying that it's not a matter of the issues, the services not being available, but they're actually not accessing them. Is that what you're?
I wouldn't say that.
Okay.
That's one of the reasons we're doing the study, the needs assessment, to actually find out what the needs are, as well as what, like the mainstream agencies, how they could better serve this population, right? So in one of the questions we're asking is, what are some of the barriers for you to actually seek help? And almost all of them, the adults, are saying it's language is one of the major barriers for them. So having counselors like Kamalesan, or having a psychologist like Pushpa in the community is like a great asset for the community. But our goal is to actually have more of those available, because not everybody's going to be able to travel to Scarborough to access these services, and we do have Tamil people spread out all over GTA and all over Canada as well. So we need to increase counselors. So we can't really hire like only Tamil speaking counselor, like a counselor who only speaks Tamil. So it'll be like a counselor who also has Tamil as a second language would be a great asset, because they could see mainstream clients. At the same time, if a Tamil client comes, they'll be able to access them as well. So that'll be a goal, I guess, through this report, to increase services for Tamil community.
So this conversation on barriers is very interesting to me, and Dr. Pushpa, I want to get you to speak about stigmas. I'm going to read another comment that we received from a watcher of the show as well. Priya Darshini Vara, she says, I strongly feel that Tamil communities back home and in Canada carry a huge stigma around mental health issues, and as a result don't get the help they or their family members are in desperate need of. They may be conscious about what others may say, how it may be seen at a workplace, or thoughts revolving around karma. And she had a whole bunch of other statements of this nature. Can you speak to us about stigmas? Why does the stigma exist, do you think?
You know, stigma exists in all communities, and even in mainstream communities. Like, I just thought about an example, like even these American soldiers going to Afghanistan and Iran, Iraq and all these places, and they may get killed in the war, and they get a different type of honor rather than one person who commits suicide in the conflict zone, right? And I heard that, I've read that the president sends a letter to those who have been killed, but it was not being sent to those who commit suicide, because it's seen as an act of kind of a sign of weakness, right? And they didn't. So this kind of sense of mental health being a weakness thing, like it's you hear it from all sort of people, like white guys coming and saying, you know, I don't want to see a psychologist, I'm not crazy, right? They go like that, right? But more specifically, I think from many of our countries where we come from, we don't have psychologists, we didn't, even now I don't think we have that many, and we didn't have counselors, social workers, any of those things. So whenever a person behaved abnormally, to the extent that they become psychotic, then you have the mental health hospitals or asylums, right? So people don't see it as a kind of a continuum. So
they see it as that extreme.
Yeah, at the extreme level. And what happens is in our own countries, in our home countries, like we had the space to be different. Like, if somebody lost someone or something like that, and they may be grieving for maybe 2-3 years, like here it would be seen as pathological, right? But there you had the space, like people accepted it, people would support, and there was always someone around. But those things are not here anymore, right? So these are the issues, and also just wanted to talk about the karma thing. It's not that negative to think that this is my karma, because I think it's one of our coping mechanisms, because a lot of things cannot be explained, right? In the West, we look for explanations. We want to have control over nature. We want to kind of be the person, right? But in our communities, we just live with it and we accept things, which is very nice, and you can always explain things. Okay, so that's maybe my bad time, or that's my karma. So it kind of takes the guilt out of you, because a lot of people we see in the Tamil community, even they are depressed, they are not very much guilty. They don't think that they are being punished or something, which we see a lot in the mainstream communities, right? So that's a good thing. And even in our community, we say like, okay, Vidhiye Madiyal Velalam, we say, right? So it's not just everybody thinks about fate, but they also think we can do something about it. So I think it's good to have these coping mechanisms, but it can go to an extent where it doesn't work anymore, right? So then only we have to kind of think about, okay, so maybe I should try different ways of getting help, right?
Interesting.
Yeah.
So, Cam, I'm curious to hear your point of view here too. Dr. Pushpa has spoken about these coping mechanisms that existed, if we can use the words back home for people that came over. Do you think that those coping mechanisms exist here, or do you think there's a breakdown of that structure?
I'm sure it really made sense. Those coping mechanisms definitely exist. But with the stigma, I would like to add a point.
Yes, please go ahead.
Dr. Pushpa correctly pointed out that stigma is in every culture.
Yeah.
So we should be very clear on that. It's there in every culture, but it's big for us because our culture is basically more based on shame-based culture. That's the word. So with that in the society, so we are so aware of what other people would think. For example, I'll give you an example. Mental illnesses are the best kept secrets in any families. Many families keep it as like a tight hold secret. They don't even discuss that within the family.
Within the
what's happening to the other member. So it becomes really difficult with the existing stigma in any culture. So yeah.
Yeah, I just wanted to add to that, because I'm really fully agreeing with what you're saying, because I don't know, we have so much, we have spoken about this in many other contexts, we are so much concerned about what other people think about us. So we are not willing to invest in health, right? So it's just, we can say that maybe people don't know where to access services, or they don't, but many people don't want to, or they think, it's just like seeing, we take it as something, as a pride actually, to say, we say that back home, I've never seen a doctor, I'm good because I never seen a doctor. And the same way, I never see any professionals. That's seen as a kind of a strength or something. And, people may be willing to buy a big house. They don't have the money to pay the mortgage, but they big houses, buy big houses, a nice car, and they get all these, expensive clothing. They go as a family to a wedding. And that's enough for them, because everybody sees, okay, see, look at that family, they're doing so well.
Outwardly, they're a sign.
Yeah, but there are so much issues going on inside, right? And they don't want to focus on it. So I think something that's, I don't know, sometimes I've thought, is it something unique to our Tamil community that we are so concerned about others, not ourselves?
Juanita, would you like to?
Yes, definitely, yes. Basically, just going back to our culture, there are two things that are very important. Back home, when we say mental illness, it's like the extreme form. So if you're schizophrenic, or if you're a person experiencing schizophrenia, you're sent to a hospital maybe in Tellipala or Angoda, right? And these places, it's like a towns that, because they have a mental hospital there, people don't even want to say back home that they come from that town, because then you're considered maybe you have some mental illness. So mental illness back home, just like Pushpaka said, it's not a spectrum. It's just at the very extreme end. Yeah. And also because our culture is that if you have to get married to someone, right, and you cannot say that somebody in your family has mental illness, because nobody will come and marry into your family. And when you see the surveys, the ones that we did, the adults don't want to talk a lot about mental illness. They stop at talking about maybe stress and depression. Then you see the youth saying, a lot of them saying people need counseling. So the counseling seems to be very normal for them, whereas the adults are not talking about counseling at all, because it's not something that they grew up with. So they don't want to admit mental illness, whereas the youth are really okay to talk about mental illness.
You know, there was a statement that was sent in by another viewer that echoes exactly the statement that you've made. He said, this is a comment from Ashokan Gunanathan. He said, many tend to think that mistakenly tend to think that mental illness is when a patient shows signs of extreme behavioral disorder, or that everyone who has a mental illness goes to an asylum. So his point is that, you know, you wait for the severity of the issue to be significant before you think it's actually declared mental illness. So, Cam, I've got a question for you about that. So I think that we can say that certainly, I mean, the stigmas exist, but I'm curious as to, when it comes to youth, are they seeking help for things like depression, even if it's sort of, I hate to put it this way, a mild form of depression? Are people that you work with seeking help for that?
Unfortunately, not from the Tamil community. Usually, the Tamil families I see there are like there have been problems existing for like years, and then it gone out to a full blown out stage, and then they have accessed some of our services. So
what is that particular barrier? If you're telling me that, I mean, you said earlier that the parents may be resistant to getting that, but the youth recognize that, yeah, I think when someone is feeling X, they ought to get counseling. Then why are they not accessing it, you think?
A lot of the times, youth do have some sort of a support at school. So they have guidance counselors, they do have social workers who go into schools. So sometimes they'll be talking about it. So in one of the questions I was asking, who do you talk to when there's like an issue, like if you have an issue, who do you talk to? And 1/3 of the youth still say parents or siblings. So they're still not talking to like a counselor or an external person. Almost no one said a counselor, but they're saying we'll talk to a teacher or in the school. A lot of them are talking to their friends about that. So the kids are not bringing themselves up to actually traveling, taking buses and changing over buses to go to an agency actually to see a counselor. But if they're referred there by someone, or if their parents bring them there, they'll be able to come. But their kind of world is everything that's around their house or around their school. So if a service is close to them and they're familiar with it, they'll access it. And if it's far away and they don't know about it and they don't know how to get there, and they're not going to come by themselves to access a service. So they'll rather talk to someone at home or a friend, and they just think
they recognize that's what it is, but
they don't know. Actually, it could be that they don't know where the services are or how to get to the service.
Okay.
Yeah.
And like on the same thing, like with our survey as well, like I'm very clear that there's lack of funding.
Yeah.
That's very clear. So because like that makes like we have one psychologist, she's at Scarborough, like I'm in Scarborough. Like we have a big population here. So lack of services which is available near to them is one big issue. Families not seeing mental health as a priority is another one.
Okay.
So, but I think the funding comes on top of anything else here.
And you know, you have to have a multi-prong approach too.
Yeah.
And we're going to get back to talking about that after our break. We will take a break now. More on mental health in our community when we return. You're watching Crossroads on TVI with Manjula Salvaraja. Manjula Salvaraja. We've been speaking about the state of mental health in our community. We would like our audience to call in again. If you have a comment or question for our panel, we'd love to hear from you. So let me get back to talking about funding and sort of the services that are accessible. Cam, how important is it to have Tamil speaking counselors or counselors that are sort of sensitive to that culture in the community?
Yeah, like more than the speaking, I think counselors who are culturally sensitive. I prefer someone who was born in that and raised in the family, who would understand the family values and the structure and various values the Tamil families hold. When I approach with my client, that really works, because families come in through and the trust just develops so easily, and the fear of being judged is just taken away. So it's big. I think some of my clients have told openly, like even when they walk into our offices, if they see some people who look like Tamil, probably is warm and welcoming, they feel at ease.
Interesting.
Oh yeah, I'll not be judged here. That's the kind of comments I kind of feedback I get from some of my clients.
Now, Dr. Pushpa, just adding on to that, I know that when we had a conversation before the show, you mentioned that, you know, there are services that are not covered by OHIP, right? What's the effect of limitations like that?
No, it's really the system. So this is the broader system which has difficulties, because you know, you usually thinking about the Tamil community, they all have family doctors, so they go, and then you know about family doctors' offices, Tamil offices. It's overly crowded, they have 10 minutes to talk to, but then it's not giving you a good opportunity to talk what you really are concerned about. Then if you do, then maybe the family doctor says, okay, I'll give you medication, or if they're lucky, they'll get a referral to a Tamil psychiatrist. And then again, Tamil psychiatrists or any psychiatrist now, they don't do much therapy, they give medications, and then you see them once in 2 months or 3 months, so for a 15-minute conversation. So because all this is OHIP covered, so people want to get that services, but we all know that even there are now guidelines for that, like if it's not a serious mental health issue, you don't have to go on medication. It's actually, again, it works against you, right? Because you get dependent on medication. So, but what are the services people have access to, right? So you have to, the family doctor has to know what services exist. Are there any Tamil speaking counselors, culturally sensitive counselors? And if you have to come to see a psychologist, you have to pay, because it's not covered by OHIP. And I think even social workers are not covered by OHIP if they're working out of a hospital or something. So then people don't want to spend that much money. You know, they don't want to pay anything for their health. So that's what it comes out to. And then another thing is they come with an expectation of a short-term solution for problems, right? They come, sometimes they talk about, like they take an hour to explain, and then they'll ask at the end of the session, so tell me what to do, right? And they're not going to come again. So it's that mentality of also having to, so maybe that also has to do with dropouts, right? Because they think they may have struggled for 4 or 5 years with an issue, and then they want to, like just taking a pill, they want to get counseling or they want to get therapy, and then that's it, right?
And if they can't fix it right away, they think, well, it's just part of my fate, part of my... Interesting.
And again, and our communities are not so used to coming into an office and talking to a stranger. Though it, as you all said, it's helpful to see a Tamil face or even a brown face, you become more open. But our cultures, they say, like high context cultures versus a lot of Western cultures which are more low context, in the sense you can go out and talk to a stranger, you can just fit into a framework and talk about your issues. But our people are not like that. And as Juanita was saying, even our young people, if they're not able to commute to go to a counseling service far away, then you know how they've been brought up, right? They are not given the independence to kind of move on and see things for themselves. So then they become they take these cultural traditions from their parents, and they don't find it comfortable to come and talk to people outside their families or friends about an issue.
So I think sort of what I'm hearing from all of you is there's definitely stigmas and things that are internal to the community that definitely need to be solved. But I found it interesting what Cam said earlier, and you highlighted too, is this idea of funding. At the end of the day, that needs to happen first, is what you said, Cam. So Juanita, speak to me about that. I mean, what do you think is missing out there? I mean, do we have enough? Do we not have enough? What's the story?
Definitely the services are not enough.
Okay.
But then the government's on a spending cut right now, right? So especially for social services sector. So I don't think we're going to see anything from the government anytime soon. But then organizations such as Psychology Foundation and CAMH that are out there, Center for Addiction and Mental Health, they may be able to fund some pilot projects just to see how it's working or if it's helpful and things like that. Now, for someone to recognize this community needs help, then the community has to actually go and seek that help for them to put that service there. So if our community is not ready to access the service, but we know they need the service, then they're not going to give the service to them. So it's like a catch-22 situation. So what we have to do first is maybe create more awareness about mental illness and mental health in our community. So we do like walks for mental health, or we do a lot of TV dialoguing like this, a lot of paper articles, and having like small community discussions about mental health. And then people this becomes like an everyday household topic. Then when it's normalized, then they'll be able to seek help and they'll know more about it. So it's like there's 2 steps before actually going to funding, because only if an agency sees the need, if more Tamil people walk into an agency demanding service, then that agency is going to say, look, I have this many clients who deserve the service and we need to get funding.
So you've talked about people actually, yes, they need to go in and demand that service for someone to recognize that funding needs to be available. Right. But do you think the larger community needs to be advocating on behalf of a segment within the community?
Definitely, yes.
And is that happening right now?
It's starting to happen. Like I see a little bit more awareness with autism. I see a little bit more awareness with depression right now. People are openly talking a bit more about schizophrenia and things like that. So it's just in the beginning stages, and then the larger community has to realize this is for the betterment of the entire community. So we need to get on this. We need to spread the awareness and create awareness.
Okay, and you mentioned there is a walkathon coming up.
Yes, there's a walkathon coming up for Center for Addiction and Mental Health on September, and it's going to be in Scarborough. So
September 16th.
16th.
Yes. That's right. Okay.
That's right.
I should. So that's in support of wonderful initiatives like this. So Cam, I've got a question that may eventually come to us from our audience. So I'll ask you, if people are watching and they think they need to seek help, or they think I need to just sort of make that first step to talk to someone, where can they go? Is there someone they can call? Are there organizations that they can go to?
If they are in Scarborough, there is YouthLink. Of course, YouthLink runs a free counseling service, and it's free for from youths and families. And there is a walk-in service on Wednesdays, where clients can just come in and just try the service and see how it works for them. And that's really good to have in the Scarborough area. I would really want viewers to take a good opportunity for anybody to come and just consult as well. This is what I see, what do I do, or what needs to be done. So it's free. So
wonderful. Well, you heard it here. Thank you so much. That is all the time we have, but you've been wonderful in being very frank about this. And we'll obviously have you all on, because we're going to come back to this topic in a couple of weeks as well. We'd like to take a break now. You're watching CrossRoads on TVI with Manjula Salvaraja. I think that thing isn't working. Welcome back to Crossroads on TVI with Manjula Salvaraja. Dr. Thangamuthu Sathyamoorthi is the current medical superintendent at the Vavaniya General Hospital in northern Sri Lanka and a respected humanitarian. In 2009, he and two other doctors arranged for the evacuation of around 14,000 patients from the war zone and post-conflict offered patient care to around 300,000 internally displaced people in camps. His courage and efforts were recognized with the coveted 2010 Interaction Humanitarian Award. We are so pleased to have him in the studio with us today. Welcome to the show. So Dr. Sathyamoorthi, perhaps let's start with, you were the keynote speaker at the event yesterday that was raising funds for Kalvi, a charity that provides loans to students who want to go to university in the north and east of Sri Lanka. And these are students that are disadvantaged, so they may not be otherwise able to go to university. Why is that important, you think?
Actually, the northern east heavily affected by the war, and many families were affected, and their economic situation is still very poor, and they are unable to send their children to university and have higher education. Even though after going there they have to face a lot of problem regarding their financial expenditure, because their families are unable to support for the financial needs or spending in the university. So we have set up an organization, is called Kilinochchi Education Development Trust. That organization is providing loans to the student. So after their studies, they have to repay the loan to the trust, and we can support further to other batches. So that is our basic idea. That is now the money is revolving setup, and that is the reason I came here to have this program yesterday. Actually, yesterday Kalvi Connections organized the program, and
it was to raise funds for the Kilinochchi Trust Fund.
Kilinochchi Trust
Fund. How did you feel sort of being there at the event and meeting donors and making that keynote speech?
Yes, I met several people here. That is a wonderful event, and I explained the situation over this area. Not only Kilinochchi, we are going to extend to other districts as well in the north and east, but our initiation is from Kilinochchi. This program was very well organized to raise the awareness and to give more information to the situation in the north and east.
Okay, so that takes me to my next question. I think that our audience would be curious to hear your point of view on this. Is what do you think are the most pressing needs of the population in the north and east of Sri Lanka?
Actually, now after the war, now one side the development is going on, but still there are many more gaps, especially health services and educational development, and more importantly economic situation to the individual families.
So you mean livelihood, right?
Yes, livelihood, and many of them lost their livelihood during the wartime. So now they are recovering, and so they need additional support in addition to the normal development is currently going on.
Okay, and expand on what you mean by sort of the the health issues that you mentioned. You said that there's are we talking about sort of basic health needs? When I asked you that question about pressing needs, is it basic health needs? Does it also extend to sort of mental health issues?
Especially mental health issue is the major issue, because almost all the population in that area underwent a severe traumatized situation. It's not for 1 or 2 months, it was so long, maybe 2-3 years. So in that traumatized situation, now people, even though they come to the normal situation, but so many people have problem.
So the residual, it's still Okay. And how does it manifest itself? Are you seeing depression? Are there other issues that come out of that?
There are many more issues, depression and even suicidal tendency, and going for the alcoholic behavior. So in addition to this mental health, these economic situation also combine, and people, family separation, and some more the new emerging problems are coming.
Okay. Now, are there any NGOs or any other organizations that are working on some of these aspects, the mental health?
Yes, in fact, the government system is there. Each district, so there are mental health units. They have the mental health ward in addition to the outreach clinic. But there are NGOs also doing the mental health activities, work with the government system. But we have to strengthen more and more in that sector.
Okay. And so in your role as superintendent, what do you find are the challenges that you run into? Is it funding? Is it just the complexity of the concerns that you run into?
Yes, definitely funding is one component. Even though there are many organizations, funding and the recovery process is going on, still there are many more gaps. In addition to there, capacity development is the other major issues, because we don't have right persons to all the vacancies, so still many area lack.
You mean medical personnel that you need?
Not only medical personnel, even the counselors in some other categories.
Okay. Oh, so that's right, because there would be vacancies as well. Okay. So how do you think this is something that there's several conversations about here. People in their homes, at forums, at events, always think, well, how can, the average Canadian, a Tamil Canadian, help? Because I think there definitely is the desire, and hopefully, you have some suggestions for how we can directly, help circumstances.
I think already, most of the Canadians are helping in different ways. Before war, during war, even after war, they are supporting like individually. I understand that many people are supporting to the individual families, students, and if they come to those areas and supporting some organizations, so supports are going well. But our mission, to improve the educational sector development, education is one of the vital sector to post-war area.
Why do you think that is? Is it because that you hope that these are people that then come back and rebuild the community?
Yes.
Okay, because it's a long-term investment.
Yes,
right?
Definitely, it's a long-term investment, and if they don't have these facilities, they will tell in the future, we didn't have these facilities, that's why we are in the state. So it's a right time to support this sector.
Okay, so you would say definitely education is an important investment. What about other things? Do you think are there anything more immediate, and supporting NGOs that do mental health services or hospitals or things like that?
Yes, all the sectors must be strengthened, but is economic situation is the other major concern, because still many families are poor conditions. They are unable to get enough money to their day-to-day life.
Okay.
So several microcredit projects are going on, in terms of that category, Canadian people can support that sector as well.
And that again, for our audience, who I'm sure most of them are familiar with it, is the idea that of providing small loans to businesses, so to people, so they can start small businesses or go out and do small projects that they need to get done, right?
Yes, but because of the disorganization, even sometimes, they are unable to start even small businesses. So most of them they are starting small microcredit projects.
Okay.
So that will definitely support. Even just after the war, up to now, maybe 3 years they were very well supported by, that is the reason, people now, reasonably people are okay now.
Yeah, but they just need to, just needs to restart again, right? They need to restart their livelihood. Yeah.
Yes.
Okay, so I know that you're definitely a very humble man, but many have told me, many who have met you have told me, I'm curious. This is more of personal curiosity as well. You have had some difficult times in your life, but as well you're very capable professionally. And I'm sure that you have opportunities overseas as well. What motivates you to stay on and work in these communities?
Because I stayed, during war, post-war period.
Yeah.
There is no reason to come and settle in the other place. If I have any reason to come, like visit, I can come. Otherwise, place is okay.
It's your home.
Yes, it's my hometown. I have a very big job.
Yeah.
I am a director of the hospital. There are about 600 employees are working under me. I am a very busy man in that. I think I can do more if I stay in my hometown.
Okay.
So that is the reason. So no problem is over. People, we can go anywhere. So I think people from Canada or any other part, they all should come to our area. We also like to visit all the area
and actually see and experience
yes.
it. Yeah. Are there any sort of final thoughts? Our audience is obviously predominantly Tamil Canadian, and I think they would be keen to hear from you, because I think the sense that I have is that a lot of people want to give and want to help people out. They just need to know what to focus on. So are there any final words you'd like to share with our audience?
Basically, in my understanding, they are getting a lot of help from overseas people, especially, people supporting individual families for the economic situation, for their groups and organizing committees. So I think more logical way and more legal way, we have to do more and more support to increase the life standard of the people and to uplift their life
and their morale as well.
Yes.
Great. Well, thank you so much. Good luck with the rest of your trip. When are you heading back? Sometime next week?
In a week time, I am going back to my home.
Wonderful. Well, and going back to your family, who I'm sure that you miss as much. Thank you so much for being with us, and hopefully we'll get a chance to talk to you next time you come into town as well.
Yes, definitely. Thank you. Thank you all Canadians.
So that wraps up our show for today. Here are my final thoughts for the show. The Canadian Tamil Congress annual walkathon this year on September 16th is in support of the Centre for Addiction and Mental Health. The co-chair of the walkathon, Dr. Priya Jagannathan, said the following statement that got me thinking. She said in a talk that she did that 1 in 5 Canadians will experience a mental illness in their lifetime, and the remaining 4 will have a friend, family member, or colleague with mental illness. This is a substantial number, and it definitely affects our community as well. However, a lot of these people suffer more when the people around them live in denial. The Centre for Addiction and Mental Health is launching a campaign this year called Defeating Denial to help address that issue. We applaud this effort and look forward to seeing it hit everything from newspapers to bus shelters and help start more frank conversations on mental health. Thank you all for joining us. You've been watching Crossroads on TVI with Manjula Salvaraja. Have a wonderful week.